you said before that further restrictions won't work. The advice has come from you. Why won't they work? Ring of steel, that...
So look, I didn't take that from what the Premier had said, but the Premier... Oh, sorry. I didn't take that from what the Premier had said.
The direct word was they won't work.
I'm sorry, this is a very important point. I was asked about specific actions and why they weren't taken, and I said very clearly that if we need to do more, of course we would, based on the health advice, but we're not in the business of putting in provisions or asking people to do things if they're not going to have an effect in reducing the case numbers. Now, that is a very important point to make. We are all about reducing the case numbers, increasing vaccination rates, and we'll take any action we need to.
Specific measures,
but they have to be
curfews and ring of steel.
Right.
Your view is they will not reduce the case numbers.
Well,
I'm asking Dr. Chan why they won't reduce the case numbers.
In relation to those matters, if we thought that they would have a significant or even marginal impact, of course we'd do those things. But there is no evidence to suggest that's the case. I have every faith that the police and the Australian Defence Forces, who are working together on the ground, are taking all those necessary actions. Sometimes, as Deputy Commissioner Warboys has foreshadowed, they will set up. They will set up.
Going to Byron Bay.
They will set up checkpoints and various other things, as Deputy Commissioner Warboys already said. Police stopped. Turned around 7 vehicles yesterday. 7 times yesterday, the New South Wales Police prevented someone potentially spreading the virus to our regions. Thank you to the police force. Thank you to the Australian Defence Force for doing that activity. As Deputy Commissioner Warboys said, they prevented or tracked down people who should have been staying at home that weren't at home. Again, another example of boots on the ground, police doing what they need to do. So please know, if there are additional recommendations we get from Dr. Chan, of course we'll consider those and implement those.
And then why then, Dr. Chan?
I'm sorry?
How are you going to turn this around? How are you going to turn this around?
People at home don't like it when you guys do that.
So, Premier, you've obviously sit around crisis cabinet. Have you gone to Dr. Kerry Chan and the public health team and said, is there anything more we can do? And they've said, no, not at this point. People just need to comply with the current rules.
Not at all.
And we're really trying to understand.
Sure. Can I ask Dr. Chan to comment after I do? But the best advice we have from Dr. Chan, and she says it every day, is that vaccination is our key tool for us, as is compliance. I don't want to put words in her mouth. I'll ask her to say her bit, but certainly vaccination targeted in those areas of concern is a key tool we need to use, as well as heavy compliance activity in those areas of concern. But I'll ask her to address that.
So in general terms, we need to further decrease mobility, and the community needs to adhere to the orders. So we're still seeing a lot of unnecessary movement of people. We're also seeing compliance gaps. I mean, an example, when I was talking to one of my public health units, that they reported a case had a partner had visited a close contact. These are not the actions that we want to see when we're dealing with a virus as transmissible as COVID. So for me, decreasing mobility, decreasing the opportunity for interactions, meeting those density restrictions, adhering to your local government areas if you're in those affected communities, and also for people outside, not going into those affected communities. We need to do more if we're going to see these case numbers drop down.